Hi friends, welcome to Physiodemic. Today I will tell you about the decurvent Tenosynovitis. So many people come to the clinics and therapy setups for the treatments of wrist joint pain, and few of them complain pain over the lateral aspect of the wrist joint. When therapists assess the conditions and therapists reach to a conclusion that it may be due to the decurvent Tenosynovitis. So let's know what is decurvent tenosynovitis. So it is the painful inflammations of the tendon on the side of the wrist at the base of the thumbs. Okay, so these tendons are the extensor pollicis brevis and abductor pollicis longus. So the pain which main complaints gets worse with abductions of the thumbs, grasping activity, and ulnar deviations of the wrist. Now I'll tell you about the etiology of decurvent tenosynovitis. So it is due to the degenerations with fibrous tissue depositions and increased vascularity rather than acute inflammations of the synovial lining. So this depositions results in thickening of the tendons of the extensor pollicis brevis and abductor pollicis longus. So the most common causes is the chronic overuse and the activity like golfing and musical instrumental playings like piano and fishing activities and carpentry work and also office works can lead to the overuse injury, and this overuse leads to the inflammations of the tendon and the tendencies and narrow the fast dorsal compartment and causes limitations of the motions of the tendon. Now I'll tell you about the clinical presentation of this condition. So patients often complain radial side wrist pain radiate to the forearms with gripping activity, and this pain aggravated by repetitive liftings, gripping, twisting motions of the hand. And also therapists can note swelling over the anatomical snub box area. Patients complain tenderness at the radial styloid process area, and also therapist can find decreased CMC abductions range of motions of first digit, and also therapist found the thickening of the extensor sheath of the first dorsal compartment, and also patients complaints paresthesia and weakness of the hand. Now I'll tell you about how to examine a patient. So the evaluations of the patients begin with thorough history takings followed by a physical examination. So in history, the following history should be recorded, like history of overuse injury and history of prior symptoms, history of repetitive movement of the upper extremities, and the hand dominance should be also recorded, and the history of pregnancy and whether the patient is currently in postpartum stage should be recorded. And in physical examination, the things therapist will get the radial side wrist pain which increases with the wrist and thumb pain, and the tenderness of the radial styloid process. So, and one more thing is that is called as Finkelstein test. In Finkelstein test, whether it is positive or negative should be checked. So in patients with recurrent tenosynovitis shows positive Finkelstein test. So how to do that test? Therapy, the patient has to grasp the thumbs and ulnarly deviate the hand, and during that time patients complain the sharp pain over the radial styloid process. Now I'll tell you about the medical treatments of the decurvent tenosynovitis. So these conditions can be self-limited and may resolve without any interventions. For individual with persistent symptoms, requires plantings, NSAIDs, corticosteroids injections are the most frequent method to use. And the thumb spica splints may offer patient temporary relief, and some clinicians think that it should be used continuously for 4 to 6 weeks, and other recommended it should be wear when it's needed. So repetitive aggravating movement should be avoided, and ultrasound guided injections targeting the extensor pollicis brevis with septation is more effective than manual injections method. Now I'll tell you about the surgical treatment methods. So surgery is very rare, and usually it is for those when non-surgical treatment failed. And the goal of surgery is to open the dorsal compartment, and which makes more room for the irritated tendons. And these openings allow pressure relief of the tendons and restore free tendon movement. Now I'll tell you about the physiotherapy treatment methods. So first, patient is asked to use ice pack over that area, and which reduces the inflammations. And also in some cases the heat pack is used, and which relax and loosen the tight muscles. And patient is also asked to do deep massage over the thinner eminence of the hand, and which relaxes the muscles over that area. And the patient is also asked to do stretching of the thinner eminence muscles in thumbs extension and abduction directions. And patient is also asked to do strengthening exercise, and these exercises are registered fingers with thumb extension, registered radial deviation in thumb up position, registered supination in thumb up positions, and registered thumb opposition in thumb up position. So now I'll tell you about the evidence-based practice for the decrevent tenosynovitis. So study shows corticosteroid injections is superior to the splinting in relieving pain, and grateful radiocarpals and first CMC mobilizations relieve pain and dysfunctions. And studies show also splinting, which allowed for some movement, was superior to complete immobilizations of the hand. And also study shows heat, massage and electrotherapies were not effective for reducing disability of the patient. So thanks for watching this video. Stay tuned to the Physiodemics for further new updates. Thank you.